Well, first up today, how'd you sleep last night?
Okay.
Okay, yeah, well, you had a flight, and I know you took
Dramamine.
Dramamine. Tomorrow is actually National Sleep Apnea Awareness Day. So today we're going to try to help you get your Z's and recognize the signs and symptoms of a problem, too.
Yes, Allis.
I hear snoring.
These are big names for me to say right here. Allis Calanzes.
Close enough.
Okay, and Dr. Roberto Monteagudo.
Monteagudo, very close enough.
Close. Okay, Roberto, with sleeptest.com. Thanks for being here, you guys.
You guys know what a BLT is, right?
Actually, yeah, I love BLTs.
Thank you.
Okay.
Yeah, so
yeah, you wouldn't do a side salad with cherry tomatoes, bacon on the side, and chive cream cheese on toast?
The cherry tomato, I don't like tomatoes, but I'll take everything else.
Okay, you'll just get the BL.
Yeah.
All right.
Nice
All right,
to
good to
have
have you guys here. Yeah, sleep awareness, sleep apnea awareness month, important for people to know about. We've talked about it a lot in the show because it's very, very important and people can never hear enough. What is it for those people who still don't know?
Sleep apnea is caused by an obstruction in the upper airway. So it's categorized by repetitive pauses in breath during sleep.
What if you don't get it treated? Can it be serious?
Absolutely. It can be life-threatening. Without treatment, it increases the chances of a heart attack, stroke, type 2 diabetes, and even sudden death by more than 46%.
Are there symptoms? Can people know if they're potentially having sleep apnea?
That's a great question. You know, the two biggest symptoms are snoring and daily fatigue. So a lot of times, most Americans during the day are tired at some point between 1 and 4 p.m. That's a big indicator for being at risk.
For sure. What kind of treatment options exist right now to treat this problem? A lot of people are familiar with the CPAP mask.
Yeah, well, you do have the CPAP, okay? Weight loss. Some people try the little nose strips. And we're here to talk about an oral appliance that actually dentists can make to help patients that have mild to moderate sleep apnea, and also for those patients that have severe sleep apnea but can't really tolerate the CPAP.
Okay, so what you're saying is there's a dental, something you can put in your mouth and sleep with, I'm guessing, that's going to help with sleep apnea. So how does it work?
Yeah, that's a very good question. Actually, it's called a
it's colorful.
Yeah, it's very nice. Red, white.
If you want to point it toward camera one there, that'd be great, doctor. Thank you.
There you go. Basically what it is, it's a, in the field we call it a mandibular advancement device, or an MAD. And what it does, it just basically brings the jaw down and forward to open the airway. It's a very simple concept. And any dentist that is properly trained in sleep medicine and how to use these devices can make one for a patient.
Excuse me.
So how about in terms of people using it and user effectiveness? Because I feel like a lot of people who wear retainers end up kind of taking them out in the middle of the night. Is that common, or is it something that people, like, you know, people who choose this, they know that they can keep it in well?
Well, the thing is that most patients that have CPAPs just don't. You know, the ones that don't tolerate it just don't use them. Okay, so they're ready for an alternative device. So they're ready to try anything. And yeah, you know, there are some patients that unfortunately at the first day or so they, you know, it's a little getting used to. But after that, it's really for them it's a godsend.
And do you find that people tolerate it sometimes better than a CPAP mask?
Yes, I do.
Yeah, I believe that.
How did you guys happen to connect that you're both here today and consider treatment of sleep apnea using a dental device?
Sure. Well, tomorrow's Sleep Apnea Awareness Day, as you said. Dr. Monteagudo is our local representative for sleeptest.com, and he got involved because of your mother, was it?
Yeah, my mom a few years ago was diagnosed with sleep apnea. And so she would constantly complain about the hoses and that in the air. And so I told her, Mom, I heard something, that there's something in the dental field. I researched it, became educated in it, and then I decided to do that. So we've been doing it for the last 6 or 7 years or so. And then I met Allis, and our main goal is to educate patients that there is an alternative out there if they can't tolerate the CPAP. So that's how we kind of hooked up, and that's why we're here.
I think it's important that there are alternatives, different things for people to try. The in-home sleep test, exactly what is it, and what are you, because I know you're offering this to all our viewers, too.
Yeah. We usually hear the sleep tests at different facilities. Those are called polysomnograms. And now, and these are all FDA cleared, where you can have a sleep test at home in the comfort of your own bed, and we could actually see if you do have sleep apnea or not. And if you do have severe sleep apnea, what we'll usually do is then send you to some of those sleep centers for more in-depth testing.
Well, yeah, because most people are familiar with the overnight sleep study, where you actually go somewhere and you show them how you can sleep.
Yeah.
Hooked up.
Yeah, exactly.
Yeah.
This is something that you can do in the comfort of your own home, but still get results.
Yeah, I mean, when you're doing the sleep test at a facility, they're very, they have a sleep tech there. They're very detailed, but it's also you're in a foreign bed. And one of the biggest complaints that I get from some of my clients or patients, basically, is the fact that they don't feel comfortable.
Yes.
Okay.
Excuse me, this is a less detailed look, a typical, more accurate night's sleep. And Dr. Monteagudo, as you said, he's been gracious enough to offer all of Milwaukee residents and Morning Blend viewers a free in-home sleep test for the entire month of April.
That's amazing.
Yeah.
So you wear that at night, and then
How
you
many
get the
nights?
results. Yeah.
Yeah, you could call 1-800-SLEEP-TEST, sleeptest.com. They'll schedule an appointment at Dr. Monteagudo's office, do an evaluation. You'll take it home for one night, bring it back in the next morning. They'll have a board-certified sleep physician who reads and diagnoses the study.
That's
and then
great.
you get the results.
Then you get the results and you come back in for treatment options.
That's fantastic.
I think it's wonderful. I think it's
you.
great that it's an easy way for people to do it at home, so that you can feel comfortable in your own home, to test it, see if you do have sleep apnea. The information on your screen, free in-home sleep test through the rest of the month. The average cost for this is $500, but right now, again, they're giving it free to all Morning Blend viewers if you call the 800 number on your screen. It's 1-800-SLEEP-TEST, sleeptest.com. If you have someone who you love who snores a lot, maybe you're having a hard time sleeping, you're tired a lot between that 1 to 4 range, it might be good to get checked out, and it's free of charge. Thanks for being here, gentlemen.
Thank you
very
very
much.
much.
Informative.
It was a pleasure.
Thank you.